I will begin with myself, and as chairman, I will not recognize myself for 5 minutes. On the CARES Act, the Coronavirus Response and Relief Supplemental Appropriations Act, and the American Rescue Plan collectively appropriated nearly $200 billion in grant aid to public K-12 schools across the country, and allocated these funds by the Title I formula to ensure funds are targeted to where they are most needed. I know here in my district, in the far away in the Northern Marianas, where it is said that if I dig straight down, I would land up in Florida somewhere. But we were able to bring teachers were at reduced hours, 32 hours a week, but we were able now to bring them back to 40-hour weeks and start face-to-face instructions as well. But Superintendent Carvalho, why is it important that these funds from these two coronavirus aid packets, why is it important that these funds were allocated primarily to high poverty schools, like my district, for example?
Well, Mr. Chairman, for the reasons that you addressed, obviously, as believers in equitable practices, we recognize that not every child, not every school is facing the same challenges. And with varying levels of challenge, the funding needs to, in a differentiated way, be appropriated and delivered to directly support the needs of students and schools that face the greatest gaps. And in our district, a district that is over 90% minority, with a significant number of English language learners, where 11–12% of our children have one or more disability. We know where the need is. So the distribution of funding following a Title I methodology is appropriate because it begins with a recognition where the greatest need is. And in our district, obviously, we have earmarked and designated those dollars, and we have already spent 70% of the first ESSER allocation. We have designated and appropriated these dollars in what makes sense. Look, we know that addressing the health and safety of our students and workforce, addressing academic acceleration, simultaneously providing social and emotional support, all in non-recurring investments must be leaders in our consideration. You know, enhanced summer programming, extended day, week or year, after school tutorial programs, and the improvements to the physical facilities, which have deteriorated over time, particularly in the poorest areas and communities. So the HVAC system replacements, the sanitization upgrades to maintain good indoor air quality, all of those were necessary investments, and those investments must begin with the children of America who were in crisis before the COVID-19 crisis began.
All right, thank you, Mr. Cobal. Actually, you answered my second question as well. So I'm going to now turn to Ms. Almazan. Ms. Almazan, in light of the challenges students with disabilities faced during the pandemic, it's enough that they face these challenges, many of these challenges, even pre-pandemic, and the additional funds provided by the American Recovery Rescue Plan. What are steps that schools can take now to ensure that all eligible students receive a free, appropriate public education, given the need for appropriate COVID-19 precautions?
Thank you for the question, Chairman Sablan. The issue of free, appropriate public education for students with disabilities remains the requirement and a commitment that all school districts and states have to comply with. There have been no waivers during this time of the school closures. The question that's weighing heavily right now on many school districts and states is the idea of how we're going to make up for the learning loss that students suffered and the denial of a free, appropriate public education because they did not get all of the services that are listed in their individualized education program, their IEP. During that time. And central to that, you know, we do believe is the issue of end of the year assessments. You know, with the leadership of the Urban League, we agree that the end of year assessments, particularly in reading and math, are going to inform the conversation of what kinds of compensatory education services students are going to need. Compensatory education is an equitable remedy, not to get too much into the weeds, but it's an equitable remedy that is formed by courts to place a child with a disability in the position that they would have been in, except for the denial, the educational loss, and not receiving all the services that they were supposed to receive, particularly
Right.
during COVID-19.
Okay. Miss, I must cut you off. My time is up, but thank you for. I also once chaired the State Rehabilitation Advisory Council, and have some idea of the IEPs for students particularly. But my son's a SPED teacher, so I do get firsthand experience. But thank you very much. I will now yield